Welcome to California in Focus. I'm Keegan Kernodle. California reports that its drug spending has doubled since 2018, with a quarter of that increase coming from weight loss drugs and an unknown portion from illegal immigrants. With more on this is our California reporter, Kenneth Schrupp. Can you get into this?
Yeah, so drug spending for Medi-Cal, which is the state's taxpayer-funded healthcare program, has increased from $4 billion in fiscal year 2018-2019 to $8 billion for fiscal year 2023-2024. In the same period, Medi-Cal enrollment rose from 33% of the state population to 38.2% of the state population, or growth of about 15%. So where did the rest of that doubling come from? This new report from the state-funded Legislative Analyst Office does offer some insights. It says that 25% of that doubling has come from weight loss drugs like Ozempic. So nearly 2/3 of Californians are overweight or obese, and 40% of Californians on Medi-Cal are obese compared to 29% of the general population, which is in part attributed to lower income individuals often having more health issues and being more obese than the general population. So the report does note that the most of the increase has been from Ozempic, which is not a cheap drug. This list price for Ozempic is about $1,000 a dose, which is rather expensive. And for a large portion of the population, this spending isn't eligible for rebates. It's not eligible for federal reimbursements because illegal immigrants are ineligible to get these kind of federal payments, which means that taxpayers in California are funding a lot of the care, the entirety of the care and drugs for this population that only recently has gained coverage in Medi-Cal.
I see. And now it says that there's an unknown portion of drugs for illegal immigrants being covered. What does this mean?
What it means is that the state did not provide data or does not have data for the legislative analysts on the breakdown of how much spending is for illegal immigrants, at least when it comes to drug costs. What we have learned in earlier hearings is that as of earlier this year, the state had thus far spent $9.5 billion on healthcare for illegal immigrants. And I've also been told by Republican lawmakers that the state has told them that about half of the recent doubling in total Medi-Cal costs has come from expanding coverage eligibility to include all illegal immigrants. The state has steadily been expanding eligibility for the program over time. It first expanded eligibility to illegal immigrant children in 2016, illegal immigrant young adults up to 25 years old in 2020, illegal immigrants 50 and older in 2022, and then finally to all illegal immigrants in 2024. So this has resulted in vast expansion of the program to where, as I said earlier, about 40% of Californians are now covered by this program for low-income individuals.
I see. And what are people saying about these this doubling and the general sentiment around it?
Well, what we do know is that emergency rooms are swamped. Doctors are not really accepting more Medi-Cal patients in a manner that has caught up with the number of new patients and caseload that we have. This is because Medi-Cal reimbursement rates are very low. And this has come at the same time that we've created a new healthcare minimum wage where anybody who's tangentially in the healthcare sector, this includes a gift shop worker at a hospital, gets a much higher minimum wage. This is rising to $25 an hour. This is the cost that doctors have to pay for all of their staff. And with Medi-Cal reimbursement rates so low, taking on Medi-Cal patients could mean losing money on patients instead of even breaking even or making any kind of money to help cover overhead and other expenses that are very high in California. So Newsom has requested a $6.2 billion bailout for Medi-Cal just to supplement this year's ongoing spending because expenses are coming in higher than expected. This has led Republicans to request an audit of Medi-Cal because I think this is a program that a lot of Californians rely upon and have paid into for years, but suddenly we're finding that it's just impossible for a lot of people to get a doctor now, and the quality of care is not what it used to be.
Now, you mentioned this bailout from Newsom that he's requesting. That's for this year. What does this all mean going forward? Like, where do we go from here?
Well, it seems like the state does want to continue to expand eligibility and coverage, and also increase payments to all of the providers who provide care, increase payments to people who work in the industry. All of this is leading to significant growth in the state budget. The state budget is not looking great for this year. Earlier reports show that sales tax and corporate tax revenue is projected to be down. This suggests underlying weakness in the economy. The state has lost hundreds of thousands of private sector jobs since 2022. All of the job growth has been in government supported sectors. A large portion of that growth has been through a specific Medi-Cal program called in-home supportive services, by which individuals who are elderly or disabled can pay household members part-time minimum wage to provide care for them. This is often stuff that family members have normally done for themselves because this is what people do. People take care of their family. And this has been counted as job growth. This is accounted for, I believe, about a third of the new government jobs in California in the last few years. So even that figure is grossly overstated. We have real underlying weakness in the economy. The latest jobs report shows that California has continued to lose jobs this month. So things are not looking good. We're losing probably a lot of federal funding due to non-compliance with federal orders. We are set up for a very rough year, and I don't think the state currently wants to cut any programs and cut any services, but that might be something that has to happen. There is a federal bill that would limit some of the federal funding going to Medi-Cal, but it's not clear if that would make much of a difference.
Well, thank you, Kenneth. I appreciate you breaking this down for us. Readers can keep up with this story and more as we continue to cover it at thecentersquare.com. Thanks for joining California in Focus.